Hi everyone, it's Laura. I'm the one that's doing my internship at Indian Health Service here in North Dakota. Um, my video this week is kind of on ethics. I've come across a situation. Our agency intake worker needed to be gone for a funeral one day, so he asked if I would reschedule a couple of his intakes on my schedule, which was perfectly fine with me. I love actually doing intakes and getting to know everybody and doing the investigations and assessments, and I really enjoy that. So I rescheduled one of his patients. He was a male, about 36 years old, married with kids. He was coming in for the psychological testing for uh, getting pre-approved for gastric bypass surgery. So he was very nice to talk to. And one of the standard questions on our intake assessment is, who are your parents? And he kind of hesitated, got kind of uncomfortable when he told me his mother's name. He said, I really don't have any contact with her. She's nothing but an alcoholic and a meth user. And so he said, she's just kind of out of my life. I was raised by my grandmother. Um, and I was like, okay. And then he got really uncomfortable when he told me who his dad's name was. And he said the intake worker's name and pointed towards his office, which really kind of caught me off guard, um, because when the intake worker had asked me to reschedule him, for me to see him, he hadn't mentioned anything to me about this. And then I got thinking, well, if this is his son, is that even ethical that he does the intake? So then it got me wondering, does he even know that this is his grown adult son? So I completed the intake, and right after the intake, I went in with my field instructor and kind of asked her, does our intake worker, does he know that this patient I just did an intake for is his son? And she has been at the agency for 23 years, I think, and the intake worker, I think, is going on his 8th year. So they know each other's families and they talk about each other's families, what's going on. And she said she's never heard him talk of this son. So then it got us wondering, does he even know that this patient is his son? He was on his schedule and he's never talked about him, with the other staff members all these years. So after I talked to Marma, we did go in and talk to the agency's supervisor, and come to find out that she had seen him as a patient years ago for some other reason. And she said that, yes, our intake worker does know that this is his son, but it turns out, for whatever reason, he has no contact with him, never has. So it was just kind of interesting to come across something like this. So then I got thinking, how will this play out in our staffing meeting when I present his intake assessment and he gets assigned a counselor, or actually a psychologist for testing? So we talked it over between the field instructor and I, and just that I would bring it up as normal, and just kind of leave out who his parents are. Really, in this situation that he was coming in for, it really wasn't pertinent information. So, but come to find out, during the next staffing meeting, when it was my turn to bring him up for staffing, our intake worker stepped out because he knew that this was the intake that I had done and was going to present. So he happened to walk out and come back, after I was done. So that was kind of interesting too. Just kind of wondering if you guys have ever come across anything like that. I think it might be a situation that this type of ethical conflict might come up quite a bit where I'm at, just because, especially at the Indian Health Service, it seems that a lot of all the therapists are from that area and are either related or are very close friends, or, you know, close friends and family with a lot of the patients that come through. So it's been kind of interesting how they determine who can see who and who has a conflict with who because of relationships, or they see a patient who's related to either, I've seen their mother or I've seen their sister or I see their son. And so there's a conflict there and they can't take them onto their caseload. So it's been really interesting ethically in that way so far. Just wondering if you guys have run across anything like that, or what you would do if you did come across a situation like this. Thanks.